We're going to talk about what I consider the single biggest advance in medical diagnosis in my career in medicine. We're going to talk about those irritating soft signs on prenatal ultrasounds, what to do with them, and we'll go through a lot of the literature, but at the end, I think we'll have a very simple take-home message that makes life so much easier and better for everybody. Again, no relevant disclosures. So I was asked to give this at Rank and Ray a couple years ago, so they gave me 6 soft markers to cover, but this thought process covers a lot more than the 6 soft markers here. And kind of the take-home message from this talk is divide the soft marker into genetic-only association or genetic and structural. So the classic 2, there are others, but the classic 2 with genetic only are choroid plexus cyst and echogenic intracardiac focus. Really complicated. There's 10 million papers, all of which disagree with each other, but I think there's a nice take-home message when we get done. I love this quote from the New England Journal of Panic-Inducing Gobbledygook. Spin the dial coffee can cause spin the dial depression, spin the dial in twins, according to a report released today. And there's been more ink spilled on all these soft markers than probably anything outside of adrenal mass characterization in radiology. This was a really famous paper just saying that you can't believe most published research, and he goes into some really good reasons why. And I love this quote from a friend of mine who's since passed. So this was a paper we did, and we looked at measurements of the cerebellum and the frontothalamic diameter in a bunch of fetuses with Down syndrome and a bunch of normal fetuses, and we did tons of stats, and we got it published in Radiology, and we showed a statistically significant difference. We got a p-value. But when you look at this graph, you realize it's essentially worthless. There's a p-value in there, the groups are separate, but there's so much overlap, it doesn't help you manage a patient. And Phil used to say, this is statistically significant, but clinically irrelevant. And I think so many of the papers on these markers fall into this category. There's a lot of controversy. I like this one because doesn't this look like a little Mr. Spock there with the, let's be logical here, but unfortunately there's not a lot of truth in many of these papers. And this falls into what Gilbert Welch, he used to be at Dartmouth, he's now at Harvard, he's one of the most famous outcomes-based physicians in the country, but he talks about overdiagnosed and how we scare people by overdiagnosing things. And then this was the seminal editorial by Roy. The title, I give it to all of our trainees, whether radiology or OB, Obstetric Sonography, the best way to terrify a pregnant woman. And we've all seen cases like this where they come in, pregnancy should be really happy and joyous and celebratory, and then we find some stupid little thing, they go online, and it ruins the pregnancy for them.